Hello, we are excited to introduce to you the Better Health for Northeast New York, or BENNY, Performing Provider System in Dsrip, an innovative strategy for improving the health and the lives of our most vulnerable community members. Dsrip stands for the Delivery System Reform Incentive Payment Program. In other words, funding has been made available to encourage healthcare providers across New York State to reform or improve the delivery of healthcare to the Medicaid population through 2020. This funding was made available through an agreement between New York State and the Centers for Medicare and Medicaid Services to support the reinvestment of roughly $8 billion of federal savings back into the Medicaid system through the Dsrip program. Dsrip is about creating a more efficient and effective healthcare system, not about cutting services for patients. Dsrip goals include the creation of an integrated, community-based approach to care, enhancing patients' experience and outcomes, improving key population health measures, and minimizing system-wide cost of reducing avoidable hospital use by 25% over 5 years. Avoidable admissions are those that could have been prevented through better management of chronic conditions in the primary care setting or at home. Providing this care in the emergency room or hospital is not only costly, but it is also not the best place for patients to receive the services they need. These goals align with the Institute for Healthcare Improvement's triple aim. However, we remain focused on the quadruple aim, which also targets improving provider and staff experience. To help us better understand the goals of Dsrip, let's take a moment to look at how population health practices can impact care by introducing Maria. Maria just moved to a new city. She is a single mother of 2 children and she holds a full-time job at a restaurant. Maria does not have any diagnosed health issues, but her 8-year-old daughter has asthma. When her daughter has an asthma attack, they go to the emergency department or the ED. Because the ED is treating her daughter's acute medical condition only, Maria and her daughter return to the ED 3 times in 6 months for the same problem. On their 3rd visit, Maria works with a patient navigator who was recently hired in the ED. The navigator refers Maria and her daughter to primary care services through a patient-centered medical home. During pre-visit planning for the visit, the pediatric nurse noted Maria's multiple trips to the ED for the asthma attacks. The provider makes some changes to the patient's medication and also asks Maria if there have been changes in the environment that might be causing more frequent asthma attacks. Maria mentions that in the building she just moved into, she has noticed cockroaches in the apartment. The provider recommends that Maria speak with a social worker who can provide better guidance about organizations in the community that can help with this issue. The social worker uses an online directory to look up community-based organizations that provide home-based asthma services and helps Maria make an appointment. He notes this activity in the patient's electronic medical record so he can check in with Maria at her daughter's next visit. She also makes this information available to the rest of Maria's daughter's care team through the Regional Health Information Organization, or RIO. The social worker also recognizes that Maria seems stressed. When he asks her about it, Maria mentions that she has had to miss a lot of work to pick up her daughter early from school. She is worried that she will lose her job. She has also been having severe headaches, but she has not been able to visit the doctor because of the work and child care issues. Upon hearing this, the social worker looks up CBOs that provide free or low-cost after-school care that Maria can consider. He provides her with a list of organizations that she can visit on her own. During this visit, the practice's care team was able to address not only Maria's daughter's medical condition, but also the family's environmental conditions, insufficient child care, and Maria's employment. These are called social determinants of health. The World Health Organization defines social determinants of health as the conditions in which people are born, grow, live, work, and age. They include education, social and community context, health and healthcare, one's neighborhood and environment, and economic stability. Socially disadvantaged populations consistently experience a high burden of disease, injury, and violence, and have fewer opportunities to achieve optimal health. These are called health disparities, and they often lead to avoidable emergency department and hospital use that Dsrip seeks to eliminate. Addressing the social determinants of health is a cornerstone of Dsrip and the population health model. Why is Dsrip important? Dsrip is essential for many reasons. First and foremost, individuals and communities are not getting the services they need to achieve optimal health. Beyond that, both state and national healthcare spending continues to rise, while our health outcomes are often worse than those in nations who spend less. Why is Dsrip important to you? Because your organization has chosen to partner with us in an effort to transform the healthcare delivery system. Dsrip is truly a community-wide effort, and as a part of our community, you will help transform the system with us. To address these issues, Dsrip's core concepts include population health, which is driven by outcomes and influencing the well-being of a larger group. Patient-centered care, which ensures that a patient's preferences, needs, and values, including their cultural needs, guide all clinical decisions. Care coordination and care management, which provides systematic practices and organization across providers to assist and engage patients with their care. Clinical integration, which coordinates care across the continuum through people, processes, and technology. Value-based payment, which pays providers for value in patient outcomes, rather than volume or more services. And the real key, collaboration with multiple provider types, such as social services and other sectors, consumers, and the regional workforce. To carry out the Dsrip mission, the state was divided into regional areas called Performing Provider Systems, or PPSs. Each PPS covers a designated region of the state and has a lead entity responsible for facilitating regional collaboration on project implementation. Formally recognized as the AMCH PPS, in March of 2017, a new corporation of Albany Medical Center, Better Health for Northeast New York, or BENNY, was approved as the PPS's lead entity. The PPS spans a 5-county catchment area that includes Albany, Columbia, Greene, Saratoga, and Warren counties. BENNY has contracted with more than 70 community healthcare organizations, including yours, to facilitate the transformation of care. Our partnering providers include behavioral health and substance use providers, clinics, community-based organizations, hospitals, primary care and specialty physicians, health homes and care management agencies, pharmacies, and nursing homes. Through this collaboration, BENNY is working on 11 projects in system transformation, disease-focused clinical improvements, and population-wide health improvement strategies. Your organization may, in fact, be partnering with more than one PPS. We overlap with and collaborate with 2 neighboring PPSs, the Adirondack Health Institute in Saratoga and Warren counties, and the Alliance for Better Healthcare in Albany and Saratoga counties. You can learn more about Dsrip, the PPS, our projects, initiatives, and how you may be able to contribute to this important and exciting opportunity to improve the healthcare system by visiting our website at www.bennypps.org. As part of your duties at your organization, you may participate in Dsrip activities that support one or more of the 11 projects. If you are involved in a Better Health for Northeast New York Dsrip project, committee, or initiative, you are bound by Better Health for Northeast New York compliance program. Noel Hogan is the Chief Compliance Officer at Albany Medical Center. And for better health in Northeast New York, this presentation is to provide participating partners and other affected persons and parties with training about the compliance plan and the requirements and expectations necessary to support and benefit from participation in any of Benny's programs or activities. All partners, members of their workforce that support Benny projects, board members, and organization executive leadership are required to complete this orientation training. In addition, any providers or other organizations engaged by a partner in an activity that supports Benny projects must also complete this training. Organizations that participate in government programs are expected to have implemented an effective compliance program, consistent with the guidance of the Office of the Inspector General and the New York State Office of Medicaid Inspector General. Providers may be required to have a compliance program already. The compliance program for Benny does not replace that requirement, rather supplements it for those additional activities required by our participation in the Dsrip program. To file a report of fraud, waste, or abuse to Better Health in Northeast New York, call the anonymous tip line at 518-262-4369. The Benny Compliance Program and Code of Conduct is located on the Benny website at www.bennypps.org. Within these documents, you will find information on expectations for assistance in the resolution of compliance issues, sanctions for failing to report suspected problems, sanctions for participating in non-compliant behavior, sanctions for encouraging, directing, facilitating, or permitting non-compliant behavior, and expectations that compliance-related disciplinary policies are fairly and firmly enforced. If you have any questions related to the Benny Compliance Program or about this presentation, please contact the Benny Chief Compliance Officer, Noel Hogan, at 518-262-4692. We welcome your questions and invite you to visit us on the web. Working together, we have the power to create a better health for all people in our region. Thank you.